State lawmakers are debating a bill critics say will change where you get your medication. The bill shakes up the operation of certain pharmacies like CVS. The change targets what are called pharmacy benefit managers. They act like middlemen between a pharmacy, drug maker, and the insurance company. Supporters of the change say the bill levels the playing field for community pharmacies competing with corporate giants. Critics warn if the bill passes, we could see hundreds of pharmacies close across the state. 10 News reporter Alana Mutnick explains the stakes for you and your local pharmacy as well as your wallet. Alana?
Yeah, John, that's right. This bill targets pharmacy benefit managers. That's also known as PBMs. For example, when you go into a pharmacy for medication, insurance pays most of that cost. A PBM sits right in the middle and decides what drugs are covered, negotiates some of those prices, and decides how much pharmacies get paid. This bill is saying a company can't be both the middleman, which is the PBM, and the pharmacy. It's a bill CVS Health says could force it to close all 134 of its pharmacies in Tennessee. In a statement, the company says the proposal would devastate access and affordability, affecting more than 1.5 million patients in the state.
It'll affect all of us the same way. We're going to have to find other avenues to have health care.
Seth White has spent more than a decade with CVS and says this bill could change his future.
Am I going to go to another chain? Am I going to have to go to an independent? What is that going to look like for my family?
But it's not just his family he's worried about.
If a kiddo gets sick, they can't just walk into a CVS anymore to be seen in a minute clinic. There's a lot of trickle down that would affect not only us, but tons of pharmacies in the area.
Pharmacies like Max Pharmacy support the plan. They say the bill doesn't require closures and argue the damage is already happening.
We are losing community pharmacies at a drastic rate, not just in Tennessee, but across the country.
Pharmacist Mike Wilhoit says pharmacy benefit managers like CVS Caremark have too much control over pricing and patient access.
We've had over 800 pharmacies closed in the last 10 years in Tennessee.
He knows that firsthand.
On a personal note, over the last 2 years, I have owned a number of pharmacies across Tennessee. I've closed 2 of my retail pharmacies. It's largely been due to consolidation and the fact that they're steering patients to their own pharmacies and then also paying themselves more.
A state audit released in February from the Department of Commerce and Insurance found CVS Caremark was paying its own pharmacies much more than others for the same medications, over 16,000% more for some drugs. It also found Caremark was charging employers more than it was paying for certain medications.
We're trying to eliminate the conflict of interest because if they're regulating it and reimbursing both their own pharmacies and other competing pharmacies, that's a conflict of interest.
Representative Rick Scarborough sponsors the House side of the bill.
If you're playing the other team and the other team's owned by the referees, it's going to be hard to win.
Pharmacist Matt Crawford says it's a win he desperately needs.
CVS Caremark is setting prices for themselves and for their competition, both independents and other chain pharmacies.
And he hopes this proposal could give pharmacies like his the control they've been lacking.
So when you have a PBM that's setting prices across the board for their own pharmacies that they operate as well as their competition, it distorts the playing field.
A field CVS Health says they might not be playing on if this passes.
Patients love it here. We love helping them, so I'd hate to see that kind of go down the drain.
A similar law passed in Arkansas last year, but a federal judge temporarily blocked it, citing possible violations of the U.S. Constitution's Commerce Clause. Tennessee's version is before committees now. And also in a lengthy statement, CVS says this bill endangers Tennesseans. It says it is unlikely another pharmacy could buy its Tennessee locations, and it's not possible to simply not operate Caremark in Tennessee. We have that full statement from CVS Health on WBIR.com. Back to you.
Alana Mutnick with that story.